Somewhere on an Amish farm in Pennsylvania, a cow with a deep gash on her leg is being treated with something that has no bottle, no label, and no prescription. It is a poultice made from the leaves of a plant growing at the edge of the field. The wound closes faster than the farmer expects. The plant is called comfrey. It has been healing livestock wounds for 2,000 years. In 2001, the FDA asked every supplement company in America to remove it from sale. Cows in Lancaster County still eat it. Why did the regulatory agency ban what the animals were choosing themselves? Two things explain why a plant used continuously in human and veterinary medicine for over 2,000 years. Documented in herbal literature dating to 200 AD, studied seriously as a potential replacement for soy in livestock feed, and still growing in every ditch in the eastern United States, is largely unknown to the average farmer, who buys a bag of genetically modified soy every season without ever asking what else might be growing at the edge of the field. One involves what comfrey actually contains and why those compounds produce effects that pharmaceutical chemists have spent decades trying to replicate in synthetic form. The other involves the collision between a plant that produces its most valuable compound for free and an industry that found it more profitable to synthesize and sell that compound than to allow the plant that makes it to remain on the market. By the end of this video, you will understand why the cow in that Lancaster County pasture knows something that most farmers have forgotten. Comfrey symphytum officinale is a perennial herb that grows across Europe and has naturalized throughout North America in the centuries since European contact. It grows wherever the ground is damp and reasonably fertile: ditches, riverbanks, field edges, the margins of farmland where no one tends it, but where it returns year after year from roots that can survive almost any disturbance. It grows large and fast, producing enormous soft leaves that can reach 2 feet in length in a mature plant. And it regenerates aggressively from even small root fragments left in disturbed soil, which is why it has persisted in the landscape long after any deliberate cultivation of it ended on farms that transitioned to modern methods. It has deep tap roots that reach far into the subsoil, sometimes 6 feet or more into ground, that conventional tillage never disturbs, pulling up calcium, phosphorus, potassium, boron, and a range of trace minerals from layers below the reach of most other plants, and concentrating those minerals in the leaf tissue where they become available to any animal that eats the plant. This mineral accumulating property is part of why traditional farmers valued it as both an animal feed and a compost plant. The leaves, when cut and left on the soil surface or added to a compost pile, returned subsoil minerals to the surface in plant-available form, a function that required no purchase, no application equipment, and no understanding of soil chemistry to observe and use. Every old farming culture in Europe had a name for it that encoded what it was used for in veterinary and human medicine. In English, it was called knit-bone boneset, consound, slippery root. The names were practical rather than poetic. They described what the plant did when applied to a wound or a fracture. It knit bone. It set fractures. It healed tissue. These names predate the germ theory of disease by centuries. They predated chemistry. They predated any understanding of cellular biology. They came from observation from generations of farmers and healers, watching what happened to wounds and fractures when comfrey was applied, and encoding those observations in the plant's common names so that the knowledge would survive even when the explanation for why it worked did not. The explanation arrived in the 20th century, and it was a single compound. Allantoin is the primary active compound in comfrey that produces its wound healing effects. It is a naturally occurring chemical, a product of the metabolism of uric acid in most mammals, and it is present in comfrey leaf and root in concentrations significantly higher than in virtually any other common plant. The concentration in comfrey root is particularly high. Historical analyses found allantoin content in comfrey root reaching levels that made it one of the richest natural sources of the compound known. In mammalian tissue, allantoin promotes the proliferation of cells and the growth of new tissue in the granulation phase of wound healing, the phase in which damaged tissue rebuilds itself from the wound margins inward. It stimulates fibroblast activity, the cellular mechanism by which connective tissue forms. It promotes the formation of new blood vessels that supply the healing tissue. It reduces the inflammatory response at the wound site in ways that allow healing to proceed more efficiently. And it does all of this while remaining non-toxic to the surrounding undamaged tissue, which is part of why its therapeutic window, the gap between the dose that produces benefit and the dose that causes harm is wide enough to make topical application practical in both human and veterinary medicine. Stay with me, because what happened next is the part worth 2,000 years of waiting for someone to explain. When researchers characterized allantoin's mechanism in the mid-20th century, the pharmaceutical industry began developing synthetic allantoin for use in wound care and skincare products. Synthetic allantoin is manufactured through a chemical synthesis process and is now an ingredient in a wide range of commercial wound care preparations, skin creams, and cosmetic products. Sold under brand names at premium prices in every pharmacy in the country, the topical application of synthetic allantoin is documented to promote wound healing, reduce inflammation, and support tissue regeneration, in exactly the ways that traditional herbalists observed when they applied comfrey poultices to the same wounds 2,000 years before anyone understood why it worked. The plant that naturally produces allantoin in concentrated form in its leaves and roots is available in any ditch in the eastern United States. The synthetic version of the compound it produces is manufactured at industrial scale and sold at pharmaceutical margins. The economics of this relationship are not incidental. The plant healed the wound, the lab made it expensive. The ditch made it free again. Here is where the story of comfrey as livestock medicine becomes particularly striking. The traditional use of comfrey in livestock management was not limited to wound treatment. Farming communities across Europe and Appalachia fed comfrey leaf to cattle, horses, pigs, and poultry as a nutritional supplement. And they observed that animals sought comfrey out in pasture, seeking it preferentially when it was available alongside other vegetation. This preference was not learned behavior transmitted through human husbandry. Animals in pastures where comfrey grew would move toward it, select it specifically, and return to it repeatedly over other available forage. Ethnobotanical records document this preference across multiple, unconnected farming traditions, which is exactly the kind of convergent evidence that suggests the animals were responding to something genuinely beneficial in the plant rather than to a culturally learned preference or agricultural accident. Henry Doubleday, the 19th century Quaker farmer and agricultural reformer, who was one of the most systematic advocates for comfrey in British agriculture, spent decades documenting comfrey's nutritional properties and its potential as a fodder crop. The organization that continues his work, now called Garden Organic, maintained for decades the most extensive living comfrey trial in Britain, developing named varieties including Bocking 14, a hybrid that produces high leaf yield without setting seed, making it easier to manage as a cultivated crop. Doubleday corresponded with farmers, collected their observations, and made the case systematically that comfrey was the most underutilized fodder plant in the British agricultural system. In the 20th century, agricultural researchers began to investigate the nutritional profile of comfrey systematically, and what they found was striking enough to attract serious attention. Comfrey leaf contains significantly higher levels of crude protein than conventional livestock feeds, including soy. One figure that circulated among agricultural researchers and advocates of comfrey as a fodder crop was that comfrey contained over 7 times more protein than soy on a dry weight comparison basis in certain analysis conditions. The specific number varies by analysis method and plant material, but the general direction of the finding that comfrey was among the highest protein plant materials then known attracted enough attention that comfrey was, in the years before the FDA action, being positioned as a potential revolution in livestock nutrition. Some advocates were calling it one of the most promising fodder crops ever identified. The parallel to be noticed here is specific and worth staying with for a moment. Soy became the dominant global livestock feed in the second half of the 20th century, not through any single dramatic decision, but through the accumulated weight of decades of investment in soy production, infrastructure, soy genetics, soy processing, and soy-based feed formulation. By the late 1990s and early 2000s, over 80% of soy grown globally was genetically modified, and the genetic modification was primarily the Roundup Ready trait developed and licensed by Monsanto, which allowed soy to survive application of Monsanto's proprietary glyphosate herbicide. The seed was patented. The herbicide was patented. The trait that made the herbicide necessary was patented. Every season, every farmer growing genetically modified soy was generating royalty payments upstream to the companies that held these patents. In addition to purchasing the herbicide that the trait was designed to require, a plant that grew in any ditch across the eastern United States and most of Europe required no patented seed, produced no royalty on its genetic material, needed no herbicide to manage, and contained 7 times the protein of the crop it might replace, was not merely an agricultural alternative in economic terms. It was structurally incompatible with an agricultural supply chain built around proprietary inputs that generated recurring revenue at every stage. The FDA's 2001 action was not about soy. FDA regulatory decisions are not made on agricultural competitive grounds, and attributing the 2001 action to the soy industry would be a conspiracy claim that the evidence does not support. The 2001 action on comfrey was based on the documented presence of pyrrolizidine alkaloids in comfrey plant material, on animal studies showing that high doses of these alkaloids caused liver toxicity in laboratory animals, and on regulatory caution appropriate to a supplement marketed for internal human consumption. This is a real concern, not an invented one. Pyrrolizidine alkaloids are hepatotoxic compounds found in a range of plants, including comfrey, and their effects at high concentrations are well documented. What is worth examining is not whether the FDA's concern was genuine, it was, but whether the scope of the action matched the evidence, and whether the consequence for comfrey's agricultural potential was proportionate to the actual documented risk. The liver toxicity of pyrrolizidine alkaloids in comfrey was documented in animal studies using concentrations significantly higher than would be encountered in normal dietary use of comfrey leaf. The toxicity concern was primarily associated with comfrey root, which contains substantially higher alkaloid concentrations than mature leaf tissue, and with internal oral consumption of concentrated comfrey preparations, rather than with a topical application or the moderate dietary use that farming communities had practiced for generations. Dr. James A. Pembry, reviewing the veterinary literature on comfrey safety, stated that there appeared to be no cases in medical history or veterinary records of humans or animals showing clinical symptoms of pyrrolizidine alkaloid poisoning from the consumption of comfrey under normal dietary conditions. The Commonwealth Bureau of Animal Health conducted a computer search through records of 137,000 cases of stock poisoning by plants since 1972 and found only 1 case connected to comfrey, a case in Germany that involved comfrey combined with excessive nitrate fertilizer use, not comfrey in its traditional unmodified form. The FDA's 2001 action removed all internal comfrey products from the supplement market. It did not restrict topical use, because the evidence of harm from topical application was not sufficient to support restriction. It did not restrict comfrey cultivation or farming use, because the FDA's regulatory authority over crops and fodder plants is different from its authority over dietary supplements. What it effectively did was end the commercial pathway for comfrey as an internal supplement or food product while leaving the plant itself in a regulatory gray area. The result is the situation visible in Lancaster County today. Amish farmers who never relied on the supplement market for their relationship with comfrey continue using it as they always have. As a fodder plant, as a wound treatment, as a garden plant whose leaves go into compost or directly to livestock, the cows in those pastures still seek comfrey out when it is available. The wounds treated with comfrey poultices still close faster than wounds left to heal without intervention. The practice continues because it was never dependent on the commercial infrastructure that the FDA action dismantled. What the FDA action did end was the possibility of comfrey becoming a serious commercial competitor to soy in the livestock feed market. That competition was only possible if comfrey was commercially marketable, if it could be sold, packaged, and promoted through the commercial channels that distribute agricultural inputs at scale. Once the FDA action casts a regulatory shadow over comfrey's safety profile, even the aspects of its use that remained technically legal became commercially unviable. No agricultural company was going to invest in developing comfrey as a commercial livestock feed with active FDA concern on record about the plant's alkaloid content. Here is what the honest account of comfrey's situation looks like, because this vault does not deal in exaggeration. And the comfrey story is complicated enough that it deserves a straightforward accounting of what is certain and what is contested. The compound that makes comfrey remarkable as a wound healer, allantoin, is real, and its mechanism is well documented in peer-reviewed pharmacological literature. The protein content of comfrey leaf is genuinely high, and the traditional use of comfrey as livestock feed is genuine, documented across multiple independent farming traditions in multiple countries across multiple centuries. The pyrrolizidine alkaloid concern is also real and is not invented or exaggerated by the FDA. The alkaloids are present. They are hepatotoxic at sufficient doses, and the question of what constitutes a harmful dose in normal dietary use remains genuinely contested in the scientific literature, with researchers on both sides of the question holding defensible positions based on available evidence. The honest position on comfrey is this: mature comfrey leaf, used as a component of a varied diet for livestock, not as the sole feed source at the levels that traditional farming practice employed, has not been documented to cause liver harm in livestock across generations of use by multiple independent farming communities. Comfrey root, young leaves, and concentrated comfrey preparations carry higher alkaloid content and higher risk, and caution with these forms of the plant is justified. The FDA's action was precautionary in the context of dietary supplements, intended for human internal use at potentially high and concentrated doses, where the risk profile is different from the moderate dietary use that farming communities practiced for generations. It was not a verdict on 2,000 years of traditional veterinary use of mature comfrey leaf at moderate levels. And it did not touch the practice in Lancaster County, where the Amish farmers never relied on the supplement market to tell them what the plant growing at the edge of their field was for. The cow on the Amish farm with a poultice of comfrey leaf on her gash is receiving allantoin directly to the wound site, in the form and concentration that farmers have been using without documented harm for 2,000 years across Europe and North America. The same compound, synthesized from raw chemicals rather than extracted from plants, is in a cream on the shelf at the pharmacy nearest to that farm. Sold at pharmaceutical prices under a brand name that does not mention comfrey, formulated by a company that does not benefit from anyone knowing where the compound originally came from, or that it still comes from a plant that grows in every ditch in the county. The plant is still in the ditch. The wound is still healing faster than the farmer expects. The regulatory document from 2001 is on file at the FDA, and in the pharmacy, the synthetic version of what grows in the ditch is selling well. The animals knew. They have always known. The farmers who watched them knew too. The names they gave the plant, knitbone, boneset, consound, were never marketing. They were just accurate. If you found this genuinely useful, watch the next video and do not forget to subscribe. See you in the next one.